Hi, I'm Annie Butterfield. Our goal at Steward Healthcare's Behavioral Health Services is to provide a safe, effective, high-quality experience for our clients, both adults and geriatrics. We have 3 inpatient units, an outpatient unit, and are now offering telecrisis in the hospitals, as well as accepting new clients for outpatient medication management and therapy appointments. We are honored to be a member of the Zero Suicide Initiative by the State Division of Mental Health and Substance Abuse and the Utah Hospital Association's Behavioral Health Work Group. To learn more, call 801-964-3560.
Good morning. My name is Jerry Buie. I'm a clinical social worker, and I'm going to be presenting on something a little bit different than I've historically presented on. I get asked to do a lot of different presentations on diversity and LGBTQ issues because of my professional background. And I made the mistake of talking to a friend of mine about aspects of my personal life that she thought would make a great presentation. And so I'm having a little anxiety about doing this presentation today. And I think the anxiety is like coming out of the closet, because our society has a particular perspective on the topics that I'm going to talk about today. And I was thinking about it, it's like to come out and say, hey, let's look at a different paradigm. It has its challenges. And so I'm coming out to you today as somebody who looks at life through an alternative lens, if you will. And part of what I want to do today is talk about how that lens shapes my clinical work and influences the clients and the people that I work with. With this being a virtual conference, usually when I present, I'm walking around and talking to people. So if you do have questions, I have to stay here at the podium, but if you have questions, let me know what your thoughts are. I'll repeat your questions so viewers at home can appreciate your thoughts and understand what we're talking about. So what's with this expanding health paradigms by sitting with the ancestors? What are we talking about? I want to give you just a little bit of my personal history. And this is a journey that I've been on for 25 plus years. I haven't done all the math, but I know it's been over 25 years. I've had the opportunity to travel and to spend some very intimate and personal time with people from various indigenous communities and societies around the world. And kind of my quest or my question in spending time with these communities has been to understand their world lens and their view on life. And in particular, I'm always curious about how they look at health and healing. And often what I've discovered is that's through a spiritual lens, or a lens that includes spirituality. I want to give you an example that of kind of an alternative form of healing, or we call it alternative. And I went on a trip to Peru with my partner, who has had some very serious knee injuries, to the point where the doctors have talked to him about needing knee replacement surgeries and looking at, here's what we need to do to your body to fix your body. But we're on this trip, and for whatever reason, his knee was definitely flared up, and we were participating in a ceremony, and the shaman or the healer came over and said, I'd like to spend some time with you on your knee. And we weren't sure exactly what that would entail. But at some point in the ceremony, the shaman comes over, and we're all sitting on the ground in this room, and the shaman starts singing to my partner's knee, kind of like a Mr. Microphone. just singing and whistling. And what we had learned earlier on our trip is how shamans and healers engaged frequencies to help elevate someone's spiritual or physical process. And so we were witnessing kind of this process. And then after the shaman's done singing to the knee, he takes out this substance. And it didn't look like a very pleasant substance, but he starts coating my partner's knee with this concoction of herbs and plants that had come from the jungle. And it had a rather specific smell to it. And he caked this around my partner's knee. And then he took toilet paper and kind of created a cast. And then he was told to leave that on until it was completely dry, and then he could take it off. And it literally took an entire day for this to dry. And when I asked my partner, I said, "How's your knee feel?" And he goes, I'm not exactly sure, because the knee was being held in place by this concoction. But when we took the cast off, what my partner noticed is that his knee was feeling much, much better. He received a second treatment, and by the time he went home, his knee was healed. Like, he's not needed surgery. He's not needed surgery since. He hasn't had the same problems. The shaman gave him some of this concoction to bring home, and so I think we did 1 or 2 other treatments. And to this day, I have no idea what was in that concoction, but what's interesting to me is how this healer approached the physical ailment through a spiritual and kind of an herbal approach to healing. And that's kind of what I want to spend some time talking about, is what do we refer to when we talk about healing? I don't know if you can see this, but I thought this was an interesting meme I found about, we refer to things outside of the medicalized approach to health and healing as alternative, when in actuality, many of these approaches to life and medicine are ancient in their origins. I want to also just kind of draw your attention. Part of what we were trying to do in this 25-year plus excursion is to really just understand and appreciate the value of culture, tradition, ceremony, and ritual in understanding our cultural communities, and understanding that often what we see in another culture is often just the surface. And if we look deeper into these communities and societies, we will find profound ways of relating to the world. And I want to share some of those with you here in a minute. So why is this relevant to a mental health conference? For me personally, this journey has been a very personal journey. And yet when I was asked to present, I started really contemplating about how these paradigms have influenced how I sit and relate with clients. Let me give you a little bit more detail about the communities that I'm going to talk about. And just for clarification, my personal ancestry is Sicilian and Scottish. And my grandmother immigrated to this country from Italy when she was a young adult. And my father's family has been in the country, from what I can tell, for many, many generations. At a very young age, I got introduced to a Native American elder who took an interest in helping me understand his culture, traditions, and spirituality. And consequently, through his connections, I've spent time with the Shoshone, Ute, Blackfeet, Lakota, and the Coastal Salish people, all who have very different traditions, very different approaches to life. I've spent the last 7 or 8 years working with Mongolian shamans in Mongolia, spending time with them, learning about their healing and spiritual practices. I've been to the Amazon and the Andes in Peru about 15 times, working with different shamans and elders there. And then here recently, the last 3 or 4 years, we've been working with an elder from Burkina Faso, which is the northern western part of Africa, and with the Dagara people. I've also spent time with people who study and use Santerian and Yoruba traditions. And I'm sharing with you my perspective. I don't see myself as an expert in any of these traditions. And really what I want to talk to you about is really about the constructs. So in sharing that, what I want to accomplish today, right, is understanding indigenous and cultural technologies with the challenge for the listener to expand the paradigm of mental health outside of the bias of Western thinking. Sometimes we get very consumed about our particular westernized, medicalized approach to therapy and to health. And all I want to do is encourage you to think outside of that box for a moment and how that might influence your engagement. And then to the exploration, we'll consider the spiritual as it relates to body and mind and health, and we'll draw from the presenter's experience in working with indigenous healers. So to understand, probably the first thing that I would point out is how often these traditions look at physical or mental health issues from a body-mind-spirit connection. If you think about the last time you went and saw a doctor, how often does your doctor here in Utah ask you about your spiritual health? We're very compartmentalized in this country about how we look at these issues. And yet many cultural communities would see them as integral. And I'll show you that here in a minute. And so these are some of the other objectives that I would hope to have you look at. So I found this quote that I thought was interesting and a nice way of starting this conversation. And that is, psychology work focuses more on what has gone wrong, how we have been wounded in our relationships with others, and how to go about addressing that wounding. Spiritual work focuses more on what is intrinsically right, how we have infinite resources at the core of our nature, and that we can cultivate in order to live more expansively. If psychology works thin the clouds, spiritual work invokes the sun. And I think that's an interesting distinction. In fact, I would, as I think about what's happened to our mental health paradigms over the years, and as someone who's been an educator in teaching students about different psychological formats, think about all the initials involved, right? We teach EMDR, ACT, CBT, SFT, MI, right? We've become very prescriptive in how we look at mental health issues. And managed healthcare is focused us on treatment plans, goals, and objectives, and steps, and I believe all these things are very relevant. But I think what's happened in our mental health profession is we've stepped away from tapping into the places of intuition. We've stepped away from artistry of what we do because we've become so prescriptive. I believe in evidence-based practices, but not at the exclusion of the artistry and maybe even the spiritual nature of what we do with our clients. So my question would be, what constitutes mental health or well-being? Like, how do we come to the conclusion of what constitutes mental health? Or just health in general? How do we measure that? Do we measure that by goals achieved in a treatment plan? Do we, how do we come to these particular conclusions? And I think in asking that question, right, if I were to ask that same question of a community in Africa, for instance, that may live off the land, right? They may have a very different perception about what constitutes health. Does your paradigm of health include some sense of spiritual health? And I want to make a distinction between spirituality and religion. I think religion becomes a very prescribed approach to world perspective. When I talk about spirituality in its very broadest sense, it's the connection to the world around me and how I see that world and the relevance that I play. Do I understand my purpose and relevance in that world? Or do I see myself as a byproduct of coincidence, or do I see myself as an integral part of what's happening around me? And think about how that question plays out with our clients, for instance. I would suggest, I see a lot of clients, I feel like, who have come into my office or on my Zoom calls at a place of spiritual crisis, meaning they've failed to find the vision and the hope for their own lives. They don't see themselves as having an integral role or play in the world around them. In fact, I will often ask the question, do you have some sense of purpose in your life? And then imagine if I'm someone who's in recovery or dealing with severe mental health. If I'm outside of societal's norms of what is normal, right? How does that then impact my sense of purpose and well-being? Do I then see myself as flawed and defective and therefore need to be fixed? Or do I come to understand what's happening to me in some broader context? And I'm asking these questions, excuse me, I'm asking these questions to just really kind of start priming us to consider what other constructs or worldviews might be on these topics. So one of the things I want to do is, we're going to come back to that question here in a minute, but I want to give you, I feel like I'm laying out pieces to this puzzle to help us think here for a minute. We often hear the word shamanism, or someone's a shaman. And I want to give this some context, because I think to understand the answer to some of these questions, we have to kind of back up to what are these paradigms around healing and what do they look like. So first of all, the word shaman is a word that's used a lot, but is really it's a Siberian term for basically a healer. And someone who works in the other realms, if you will. So in places like Siberia, Tuva, Mongolia, the word shaman is very, very specific to who their healers are. In Peru, you have pacos, you have curanderos, you have ayasqueros, you have people who work with different herbs and plants, and whatever their herbs and plants are, they would be seen as a healer with those particular plants. We often hear the term medicine man or medicine woman, which is, again, is kind of a romanticized American idea. But these are people in the communities of our native communities who have earned some level of respect and longevity in the community and are seen as spiritual conduits for health and healing and medicine. And so I'm going to be using this word shaman just because I think it's a word that most people relate to. So shamans tend to be people in the community who are well respected. They don't necessarily step out and say, I am shaman, but the community may recognize them as such. And what defines a shaman is somebody who might enter into an altered state of consciousness to contact and utilize an ordinarily hidden reality in order to acquire knowledge, power, and to help other people. And so that might be a connection to the ancestors, that might be connection to the spirits and the energies of the environment in which they come from. And often these shamans will identify that they work with particular helpers. And maybe those are helpers that are plants, maybe they're animals, or maybe ancestral forms. And what do shamanic practitioners do? right? It's about, think about, as I talk about this, think about what the role is of mental health provider. So shaman is about restoring and enhancing personal power. They may do acts of divination, where they might do some kind of a reading. They help restore a personal power from retrieval of soul parts. And so if somebody, for instance, has been traumatized in their childhood, a shaman may be that person that helps to restore that part of what's been lost. Shamans may work with spirits of nature, extraction and removal of spiritual intrusions, healing of the broader social and ecological community, depossession, and cycle pump. And so when I think, in particular, when I've been in Mongolia, and I'm going to show you some Mongolian shamans here, it's really interesting. These shamans dress in very elaborate outfits. They have their drums. They will beat their drums. They'll go into a spirit state and channel some entity that will work through them. And then people would come up and consult with the channeled spirit entity. And what's really interesting, because I've been able to sit and to listen to these consultations, I'm often thinking how similar the work that they're doing. We may use different methods, but I think often they are the social workers of the nomadic lands. That when I hear people talking about my heart is broken or I'm struggling in my relationship, and I often hear these shamans as they're talking to their clients about how to remedy the situations. And I would say with the other shamans that I've worked with around different parts of the world, that it's a very similar approach. That there's, I think what happens is this idea of shaman becomes over-romanticized, when in actuality they become community consultants with this aspect of communing with spirit entities. So this slide is just talking about the different ways that shamans work and how they access. I once talked to a medicine friend of mine, and I was asking him about the kind of the drama associated with some of these, the chanting or what have you. And he said what they're trying to do is create an energetic place where people have a setting in which they can be vulnerable with the work that they need to do. And that sometimes that drama is helpful to create the space for people to do the kind of work they need to do. So I want to talk a little bit about some of the constructs that I think are useful from these communities that I've spent time with. And I'm not trying to romanticize these communities. Every community has struggles. But what I want to suggest is make the contrast between our westernized approach, how we medicalize things, and perhaps how these situations are different in other communities. I don't know if you can read this or not, but basically this was talked about in this African tribe when someone does something wrong. What they do is they, instead of punishing this person, they actually take this person to the middle of the community. And the elders and the community members spend a specific amount of time talking to that person about the good things that they have done. Right? The tribe believes that each person is good, but sometimes people make mistakes, which is really a cry for help. And they unite to reconnect with him with his good nature. Okay? And so, what they're talking about is this construct. Instead of when somebody does something wrong, we punish you and we deconstruct your life, we're going to look for ways of how do we bring healing by reminding you about the path that you're on and how to support you in the community. Excuse me. This is a slide that talks about in Rwanda, I think that's where this is from. In Rwanda, they had a lot of genocide, a lot of war. There was a lot of community trauma. And there were a lot of volunteers from different places around, right, the westernized world that responded to Rwanda and wanted to help facilitate healing. And so we showed up in our good little social work attitudes, and we sat with the people. We took them into our offices, and we talked to them. And how do you think we talked to them? Tell us about your problems. Tell us about what you're struggling with. The Rwanda people at some point kicked out the Western helpers. So we don't need your help. And their explanation was, we had a lot of trouble with Western mental health workers who came here immediately after the genocide, and we had to ask them to leave. They came, and their practice did not involve being outside in the sun where you begin to feel better. There was no music or drumming to get your blood flowing again. There was no sense that everyone had taken the day off so that the entire community could come together to try to lift you up and bring you back to joy. There was no acknowledgement of the depression as something invasive and external that could actually be cast out again. Instead, they would take people one at a time into these dingy little rooms and have them sit around for an hour or so and talk about bad things that had happened to them. We had to ask them to leave. And so their healing paradigm was about being in nature, was about being under the sun, was about coming together in community and to drum and to chant and to sing and to have that in their mind, this was the approach to healing. And although we showed up trying to provide valuable resources, we were actually working counterintuitive to their own approaches to healing. I want you to think about, in many shamanic societies, if you come to a medicine person complaining of being disheartened, dispirited, or depressed, they would ask you one of four questions. When did you stop dancing? When did you stop singing? When did you stop being enchanted by stories? When did you stop finding comfort in the sweet territory of silence? Now, contrast that to, I have some other questions I'm going to pose here in a second, but think about how we approach our clients in the assessment process. We tend to want a complete description of the problem. And often, and I've seen this with shamans who, these are the kinds of questions I hear them asking people, is they're looking at when did the soul stop singing, if you will. These are another set of questions that I find interesting, right, that help shift the paradigm, right? What is the most important thing you have never done, right? What is it that you've stopped doing or accessing? How could you play a joke on your fears? Identify the people in your life who have made you real to yourself. Name a good old thing you would have to give up in order to get a great new thing. What's the one feeling you want to feel more than any other during the next 3 years? What inspires you to love? And I'm offering these questions because, again, I think these are questions that I have heard, whether it's been in Peru or Africa or Mongolia. These are the kinds of questions and dialogues that I'm experiencing as I listen to these healers, right? These people who I think our first inclination is how primitive and behind they are, how unsophisticated they are. And yet, have we ever asked our clients these types of questions to get them to start envisioning what the healing process might look for themselves, to get them to kind of step into a place of potential vision for themselves? Some different points of constructs that I would want to make is how in many societies, right, there are concepts of reality in these communities that there are no English equivalents to. In Shoshone, there is a word called Gimanora. It's a very interesting word. I don't know what the American or US concept would be of Gima Nora, but Gima Nora basically means that time stands still. It's the place when you go into a place of spirit and time becomes irrelevant. Is probably the best way I could describe it. And yet, the Gima Nora state in a place of ceremony or healing is this very desired state to be. And often in translation, it's interesting where I've worked with interpreters who cannot make a translation because this concept of reality does not necessarily trans back to a U.S. paradigm. And I think that's important in understanding, especially when we're working with clients who might be coming from these different kinds of backgrounds. But it's a challenge to our Western way of looking that perhaps we're not all knowing as we suppose to be. I think the other key point that I would make is this compartmentalizing of spirituality, right? In our culture, we tend to save our spirituality for Sundays. And in many cultures, the idea that spirituality is as integral as my physical health is as integral as the mental health, that they are all interrelated. To give an example of this, if you were to approach, I give an example. Let's say I was diagnosed with cancer. There would be physical concerns about my physicality, but the ability to access the physical healing would come through spiritual methods, to understanding how to conceptualize a full holistic approach to healing would include the spiritual piece, would include the emotional piece. If you think about many Native communities use the concept of the medicine wheel, which in its most primary form reflects the 4 directions. But each direction includes different aspects of life and health. And it's all encompassed in a concept of spiritual reality. And yet in our culture, for instance, when you go to the hospital or you go see a doctor, right, the assessment very rarely includes a conversation about how is your soul, or how prepared is your soul for the healing. And yet in many of these cultures, preparing your soul to receive whatever healing comes is critical. I like this concept of initiation. In many societies, there are different points of reference in which someone is initiated into some new aspect of life. Okay, so some of the most obvious one is if I'm a young woman or a young man and I'm shifting from childhood to adulthood, right? There, in many of these cultures would be very elaborate celebrations, ritual, ceremony to point out and to amplify that this person is transitioning from one station of life to the next. And some initiations can really be quite dangerous. In fact, one of my elders from Burkina Faso will talk about that not everyone survives the rite of initiation. And yet it's seen as a critical spiritual component. It's about kind of reaching a certain maturity, not only in the physical life, but in the spiritual life and in connection to ancestral connections. And I have found this to be an interesting paradigm to use with clients. A while ago, I had a client who was struggling with a very difficult life set of circumstances and was kind of bemoaning the circumstances. And so I used this paradigm. I said, what if where you're at in your present station of life is an initiation of something that you're being prepared for next? Like, what if the turmoil, the struggle, the anxiety, whatever's coming with it, is an initiatory process to the future? And it's interesting, in offering these kind of paradigm shifts, I've noticed that clients can take a refreshed perspective about what they're going through. I don't know that, I was thinking about this the other day, I don't know where American culture embraces the place of initiation. But it would be interesting for us to just kind of look at our circumstances through that different lens. One thing I wanted to, in many of these cultures, the idea of magic is a particular reality. Magic is the ability to shape the thoughts and projections of an individual from a pessimistic outcome to outcomes that are optimistic and hopeful. The ability to comprehend the best possible outcome is part magic and part psychological, right? Think about some of the challenges that our clients face and some of the places where they anchor their thoughts. And I sometimes will kind of engage my clients in a discussion about how they could, if they could step into a place of fantasy and have the kind of life that they would choose, what would that look like? And it's interesting how often clients want to be stuck in the reality that's got them in their situation. But if I invite them to think about it as a fantasy, as an act of magic, not that we're doing anything shamanic in the office, other than having that discussion of introducing a paradigm outside of the rigidity of where they're stuck, can often propel people in a different place. So another construct that I find is interesting and helpful is appreciating that all life is sacred. For instance, the Native American medicine wheel that gives us purpose to all life, regardless of what status, such as sexual orientation, gender identity, whether you're an animal or a bird or whatever it is, that all life has purpose. In Burkina Faso, for instance, with the Dagara people, when a woman becomes pregnant, the shamans are already in the process of accessing information from the ancestors about what that child's purpose is and will be in the community. Not that they're defining it, but they're basically saying, what is the purpose for this person coming into our community? Think about the power of that, right? We live in an interesting society that very quickly marginalizes people based on economic status, race, gender, sexual orientation, right? The goal is to get people in this society to fit into particular paradigms. And yet what I have found in these communities that I've talked to you about is they're trying to understand what the person is bringing. And with the Dagara people in particular, the community then starts to prepare to receive that person and to make sure that they have the resources available to fulfill that purpose. I want you to think about, all life in these societies are deliberate. They're not incidental. So what happens, imagine, if you will, let's say you have somebody who is autistic, for instance, or maybe they are, we would describe them as having a mental illness, right? What is the perception? How does our society then look at those individuals? I would make the observation that in many cases, right, we medicate, sedate, hospitalize, folks end up homeless, right? These folks that tend to be on the margins of society tend to not be part of an inclusive society. And what I would argue is that in many of these indigenous communities that I've spent time with, in many cases, those that we would define as mentally ill are perceived as having particular gifts and advantages to the community at large. So 2 summers ago, I went to Mongolia and went to the reindeer people, which are the northern part of a place called Taiga, which is the northern part of Mongolia, very close to the Russian border. And these are nomadic people who live off the land. They have domesticated the reindeer. And everyone in that community has a role. And we met a couple of the shamans of that community, but the one shaman that was the most respected, from my perspective, if I put on my Western mental health lens, she would have been defined as autistic. She had a lot of the characteristics of what we would label as autistic. And yet the community saw her as a very highly respected shaman, that she had the ability to help people access their emotional struggles, that she was an expert and knew how to work the herbs of the land. And that community held her up as an esteemed member of society. Several of the shamans that I met in Mongolia in particular all talked about reaching what I would call a mental health crisis, where in some cases, through Western lenses, they may have been diagnosed as schizophrenic, they may have been diagnosed having like a major life breakdown. And in many cases, they would talk about accessing westernized approaches to medicine or mental health and getting nowhere. At some point, they get handed off to the shamans, and the shamans then teach these people how to respect their gifts. The idea of hearing voices or seeing things was not necessarily labeled as a mental illness or as a problem. It was seen as a gift. How do we honor that? How do we hold space for that? How do we learn to channel that in a way that serves the community? And in many cases, I've met about 7 shamans that I've worked with in Mongolia, and each one has had a very similar story. And their families are often included in these interviews, and they will talk very explicitly about how they were fearful while they were accessing the modern medicine that they saw their loved one be decompensating so severely that that's why they, out of desperation, reached out to shamans to see, well, what could happen here? With the Dagara people in Burkina Faso, what's interesting is people who are known to like hear voices or to see things that we might describe as some kind of a psychotic break. The community does not ostracize those people. What they do is they call community council. They bring these people together. And by bringing them together, they then sit and listen and witness to what the person is saying. It's seen as channeling gifts from the spirit world. And it's important to sit and to listen. And one of the elders I worked with out there who had an American education, I asked him, I said, help me understand. So once you've witnessed what happens to these people, what happens next? And he said, usually within a couple of days, they go back to normal. You know, they go back to functioning within the community. And so I asked, well, is this repetitive? Does it happen frequently? And his comment was, if we're lucky. Which was, right, the mindset that there's something productive happening here. And so I just offer this as a contrast, not to romanticize these cultural approaches, because I could tell you these communities all do have issues with mental health and addiction and what have you. But I wonder what would happen. Here's my thought. What would happen if we interacted with our clients from a sense of what's happening to you may have purpose. Or I'm willing to listen to you and hold space and to witness what is happening for you, to see what would happen. In the community, I often will run different rituals and ceremonies that have been handed down to me from these elders and teachers. And I had a young man who came to my home to participate in a ceremony. And it was very clear to see that there was something going on for him. I could see that he was talking to himself. And what was interesting is he was incredibly conscious about, he knew what was happening to him, and he was bashful about participating with the community, that he would be disruptive. And so I talked to him a little bit, and I just introduced the idea. I said, I'm just talking out loud here, but what if what's happening for you has a purpose? Like, what if what you're hearing is important for the rest of us to hear? Like, what if this is a gift? And he looked at me like I was crazy, because it was the first time that he had ever been validated at some level that he didn't need to be in fear of what was happening with him. And so I had him participate in the ceremony. I had him sit next to me. And I just told him, I said, whenever you hear the voices, will you just stop what we're doing? And will you please let us know what the voices are saying? And he did. And it was actually quite interesting. The synchronicity of what he was sharing with what was happening in the ceremony seemed very relevant. And what's interesting, his sister contacted me after the ceremony, and she said, that's one of the few times where my brother has ever really felt like he was an important part of what was happening in a community process. And what I noticed is that he came back to a couple of other ceremonies, and each time he came, it looked like whatever was happening for him seemed to lessen. And I think it was less than what it was because he was being witnessed, he was being heard in a safe container that allowed that whatever was happening to happen. And I would say I simply borrowed what I had seen happen in these communities as how do we create a place to honor what's happening for people. This PowerPoint is going to be available on the website. I'm not going to play this, but this is an interesting 3-minute video about why the world needs shamans. And basically, just in a nutshell, what the individual is talking about is shamanism at its core, or the healing paradigms that we're talking about, is an invitation to intimately connect with body, mind, and spirit. Gabor Mate has talked, and this is also a link to a 3-minute video of Gabor Mate talking about the myth of normal. That part of what's happened in our society is a commitment to this westernized cultural approach to life that says, the goal or the objective is some sense of normalcy. And what he's suggesting is that myth is actually kind of suffocating our capacity to connect, and to even connect not only just on a spiritual level, but in an empathic way as well. I do want to play this for you. This is a documentary that's called Crazy Wise, where a film producer is telling the story of two people who are struggling with a severe mental health crisis. And then he's contrasting those crises with the different medicine people that he has met throughout the world and drawing a contrast. And I do want to play this for you. I'm trusting it will work.
I experience screaming voices. People don't believe how insane I am.
And it was terrifying. Totally manic or totally depressed. And it was, it wasn't him. The Adam we knew.
I just wanted a car to hit me or a truck or just something to take me out because this time I wanted to really work.
I really felt like I needed to end my life. I felt like I was this complete failure. So I was in really bad shape, and the mental health system only made that worse.
It's a mythology to think that there's the normal and then there's the abnormal.
The average recovery rate in the Western world, with all our sophisticated diagnoses and medications and highly paid experts, is about 1/3. The recovery rate in the developing world is about 2/3.
Where does somebody who's in this delicate state, they're in a process. They're sent to prison, they're sent to jail, they're sent to a psychiatric ward, or they're chemically incarcerated, or they're homeless.
In the United States, we've come to believe in the chemical imbalance theory of mental disorder.
These medicines are very, very powerful in helping, but they can be very powerful in harming.
I mean, like the disclaimer on these pills, that's typically the first side effect, is suicidal thoughts. And that's what the doctor is giving you to feel better. I mean, it's crazy.
We live in a psychotic society. We do. And what is meant by psychotic? Out of touch with reality.
How mental illness is constructed in different places in the world is very, very different.
Only in the Western world have we developed this bizarre idea that hearing voices and having strange ideas has no meaning at all.
My human rights work has taken me to indigenous and tribal cultures around the world. Often I met individuals who would go into a trance-like state to serve as a healer or visionary for their community. These are the people we call shaman. And I was surprised to learn that many were identified in their youth by having what we would call a psychotic break. Hearing voices, having visions, feeling terrified. I was struck by how differently these symptoms were looked at in our culture.
We have lost touch in our medical system from some of the simple needs that people have for connection, the simple needs that people have for community. Maybe it's not just a broken brain. Maybe it's not just an illness. Maybe this is not just something to hide and be ashamed of. Maybe it's something to explore and learn from.
So I apologize. For whatever reason, this was showing up on my computer, but not showing up here. But if you access the link, the trailer, it just gives you some nice visuals. I felt like the audio was still giving the point, right? Is when they were talking about the various healers, they were literally showing people from around the world, parts of Asia, Mongolia, Native American communities, reservation spaces, South America, right? That there are some common tools that might help us understand perhaps a more humane approach to things. This is going to be, I'm not going to play it because obviously it's not working, but this is from Alberto Velado, who I believe spoke last year at this conference. And again, he offers a 3-minute video clip here about how we could revolutionize our medical and mental health process by just simply incorporating conversations and dialogue and accessing clients' spiritual resources. Even just being able to have the conversation. This is an elder and a friend of mine by the name of Melodoma Somé, and I pulled this from a speech that he gave, but here what he was talking about is about what he saw happening in the mental health society. And what this says, because I don't know if you can read that from back there, I was so shocked. That was the first time I was brought face to face with what is done here to people exhibiting the same symptoms I've seen in my village. And what he's talking about is he was taken to a mental health facility, and he had seen people in various stages of how we handle the mental health in our society. What struck Dr. Somé was that the attention given to such symptoms was based on pathology, and the idea that the condition is something that needs to be stopped. This was in complete opposition to the way his culture views such a situation. As he looked around the Stark ward at the patients, some in straitjackets, some zoned out on medications, others screaming, he observed to himself, so this is how the healers who are attempting to be born are treated in this culture. What a loss. What a loss that a person who is finally being aligned with a power from the other world is just being wasted. And you know what Dr. Somé would say, what Malidoma would say here is that his society might look at someone going through this process as going through a particular initiation. That whatever's happening for them is about giving birth to something, in this case, a healer. And I know that these concepts, right, we hear them and they're so counterintuitive to the paradigms that we're committed to in this culture around, you know, if I walk down State Street out here and I see someone talking to the signpost, I fear them. I go to the opposite side of the room. I avoid them, right? Because we're kind of programmed to see these things in this way. Whereas what Malidoma would say is, in our village, these folks would be embraced and sought to understand. I don't know if this is going to work, because it didn't work on the other one. This is in Mongolia. Actually, let's do this. So this is a shaman that I've worked with in Mongolia. We call her the Queen. You see her elaborate costume, because she's royalty. When she goes into the space of spirit, she channels an ancient queen. And the queen is actually quite funny. But when she does her healing work, people approach her as if she's ancient royalty. And her story is she had a series of medical ailments that were quite crippling that the doctors could not understand. I think in many cases, because the doctors couldn't understand it, she was kind of marginalized and kind of seen as a burden. And then a friend introduced her to a shaman who said, you're being brought into or initiated into something. And so this shaman taught her how to channel her medicine. And now she's a very, again, respected, vibrant person of the community. She's integrated in, and people come from all over the country to come and to sit with her. This shaman, his name is very complicated, so I call him he shaman, because the queen is the she shaman. This young man, he's about 42, and spent about 7 years. If I were diagnosing him, he would have sounded like he had very severe depression, very discouraged and despondent about his life, had lost a lot of hope. He was becoming very suicidal. His family was very concerned about him, and they were encouraged to take him to a shaman. That shaman worked with him for about 2 years and taught him how to do his medicine work. And so this is pretty standard about how a shaman would operate as they go into spirit. Well, that's not good news. So, Well, I guess we're not having luck with audio visual today, so. So what would happen here is he would drum, and eventually you can practically see it. This spirit will come down and descend on him. His whole demeanor, that person that he channels is a very ancient warrior Mongolian spirit. But once he kind of goes into that space, then people would approach him, and in a very respectful way, they would approach him with the idea of wanting to sit and do counsel. And I've heard him do marriage counseling. I've heard him do often they will talk to people about different rituals and things that they can engage to kind of find harmony with, again, body, mind, spirit, and sometimes the environment. So just to conclude, I want to kind of point out some of the variables I think are things that we could bring into our practices, right? And so first of all is, right, the purpose of existence. Are people here, as people show up in whatever form or variation they show up, whether it's a perceived mental illness or some kind of marginalized status in society, right? That in all these cultures, there is a purpose behind existence. It's not by coincidence. When people are in distress, when people are kind of at their worst, right? That they are being witnessed and listened to. They're not socially discarded or segregated, but they're fully witnessed and integrated. It's meant to, whatever's happening to one person impacts the society. And so we create this space by listening and witnessing. Things are never pathologized. Like what's happening for you is not a particular pathology. And in many cases, it's validated, like with the Mongolian shamans. Instead of pathologizing, it's like, how do we validate it and even teach you how to work with it? Understanding the body-mind-spirit collaboration, right? That physical health is as integral as emotional, mental, and spiritual, and they're fully integrated. Incorporation of communal support and acceptance, right? The community on a whole looks at how to embrace the individual. Community support and peer supports. In the Crazy Wise video, as they track the two individuals here in the US who are having mental health issues, where traditional westernized medicine is not working, what worked for these individuals were what we would call alternative forms of healing, but it included helping them find purpose in their ailment and feeling connected to their community and of service to their community. Go back to the shaman with the reindeer people who was autistic, right? I think in many cases our society creates space, and in those societies they figure out how to embrace and incorporate. What I think is interesting is many of these shamanic practices are very strength-based, right? The shamans are asking questions and pursuing dialogue with their clients from the place of what helps you find joy, what has worked in the past, but it's a very strength-based approach, which is kind of the buzzword now with solution focus and motivational interviewing, right? To be very strength-based. And then expect recovery. How many times do we sit down with clients with particular diagnoses and we just decide that we're only here to manage the problem? Right? In these shamanic societies, right, very often it's about expecting healing, expecting recovery. If I were the Dagar people, if you don't get a healing, they go back and they chastise the spirits and say, look, you have the power. They'll go back and insist upon the healing. And they go at it from full body, mind, spirit. And I think sometimes what's lacking in our mental health communities is we're sitting in a place of burnout and pessimism. And we lose track of our ability to expect recovery. So I want to take you back to these questions, right? Because I think they're very relevant in the overall conversation about, what brings you joy, what brings you happiness, what brings you wholeness. So at this point, I think I've left enough time for questions or thoughts. If anyone here in the room has questions or if anything has happened. No? Okay. Any questions or thoughts? Yes, ma'am.
Well, I worked in Alaska with some Native Americans up there, Siberian and Inuit both.
Okay.
And their spirituality is very much like elemental, like nature and man and animals. They also have like spiritual drumming. But it seems like alcoholism has devastated that community. Is it the same everywhere?
Yeah, so the question is, the young person here in the audience has worked in Alaska with indigenous folks and talking a little bit about their connection to the elements and to the environment around them and shamanic journeying or medicine journeying work. And yet those communities have a lot of substance abuse issues and alcoholism. And again, just kind of going back to the idea of not over glamorizing these societies, right? I'm just trying to pull these constructs and say, what would happen if we had like this cultural revolution and we looked at each other with more compassion or understanding? And so I think the conversation I would have about like our Native people and some of the disparities, right, is we do have a lot of historical trauma and genocide that has kind of set up a lot of our indigenous folks in this society to struggle with some of these huge disparities. What I would suggest, what I have seen, is when communities or individuals get pulled into the grips of substance abuse, that a lot of treatment programs include these spiritual practices like sweat lodges or ceremonials, longhouse ceremonies. And the idea is to plug that person back into their spiritual point of reference and to help them get reconnected. And so I think in any society, people can get lost. And that's kind of, one of my thoughts is how what we do as mental health professionals is not so uncommon from what happens in these indigenous societies. Other than I don't think our training has been very permissive of talking about the spiritual and engaging our clients in getting plugged back in. For instance, I know a lot about these practices and do a lot of these practices in my own personal life. But as a professional social worker, the furthest I go with it is conversation and discussion. Like I don't prescribe, and this is just my own, I know therapists who do this, but I don't ever prescribe those kind of things, but I will have conversations about what would it be like for you to get reconnected to your land, to your family, to your spirituality, whatever that might be. And so I think that's how I would respond to that question. Any other questions? Oh. Yeah, so the question is, do I see what's happening in our community as opening up to these ideas? I think if I looked at COVID and said, has there been a gift associated with COVID? it's interesting how the question of pending mortality can often raise these questions. And so I see a lot of people who seem to be opening up to a process that, I would say is completely anecdotal, and people will talk to me about these things because they know it's a point of reference for me. But I have been surprised through this COVID period how frequently people have wanted to engage in ritualistic practices or spiritual practices. And I think that's just been a byproduct of COVID. And when I say people, I'm not necessarily, again, talking about my clients, but people in my community and or who have heard about that kind of work that I do. And so I don't know if that's happening globally. I certainly think there's been some other traumatic events in our recent history that's causing people to do a lot of introspective work and to ask those questions. So, and did you have one more question?
So with the shamans and the medicine world, so they use, like you said, drumming, rhythm, and maybe, do they use like any hallucinogenics or anything like that to reach the spirit world?
Yeah, so there are traditions that might use, for instance, here in the States, we have communities that might access peyote, ayahuasca, ibogaine, iboga. Even, it's interesting, I think, even the use of mushrooms, for instance, or psilocybin. What's interesting, here's what I would say about what I see happening with psychedelics. I think the medical world has gotten their hands on them, and they're medicalizing something that has a lot of tradition and practice. And so it concerns me that now that we're able to measure some of these things, that we're thinking if we just pull the spiritual component out of it, we can somehow fix it with these plants. And what I would suggest that all these plants come with very specific songs, prayers. It's a ceremonial rite of passage for many people. And so it concerns me that I'm glad that we're having the dialogue in this country around psychedelics, but it feels like we're doing it at the exclusion of their roots. And I think by doing that, we limit the potential of what those things can offer. So it looks like we've finished our time. I appreciate everyone's attention. And I look forward to a time when we can do conferences without mask and social distancing. I hope this is helpful. It's probably not your most traditional approach to mental health, but hopefully it gives you some pause to think about that might just help and impact how you interact with your next client. So thank you.